as primary care physicians, what are some of the tools that we have available to be able to intervene with that critical patient?
I think some of the things Yanira touched on as far as having a crisis intervention team that can come out and help more formally assess a patient. And we have psychiatrists that we work very closely with that can give us a better idea of how seriously we need to take these suicidal thoughts that your patients are having. Of course, one of the more kind of extreme or more alerting things we can do is to have a patient what we call Baker acted or involuntarily placed until we can assure that they're not a harm to themselves or others. And as a primary care physician, that is something that we take very seriously and a decision we have to really weigh. And a lot of times this can be what's best for patients. Patients may be very depressed. They're not quite sure what their thoughts mean or how serious their thoughts are as far as being suicidal. But that's where we sometimes intervene and make sure we get the best type of assessment from a mental health professional for these patients and really assess if this patient needs more serious commitment with their mental health care, whether it's being in the hospital for some point or very close outpatient observation with a psychiatrist.
If we can talk a little bit about what specifically are some of the risk factors, what are some of the populations that are at higher risk, Yanira?
Well, I mean, some of the risk factors are usually hereditary. If there's a history in the family of mental illness, that's definitely a cue. Other risk factors probably would be somebody with a chronic illness, for instance, like diabetes.
Correct.
I feel when you're chronically, physically not feeling well, that's a big sign of depression. Absolutely. And you may feel hopeless or wish you were,
Correct.
not around anymore. So.